this exciting panel on entrepreneurship. So let me introduce our esteemed panelists for today's session, Gurdane Bhutani. He is a founder and managing partner of MBX Capital, a venture capital partnership focused on emerging companies pursuing challenges in public health. Prior to his current role, Gurdane worked with FundRx, Bain & Company, and Morgan Stanley. Gurdane holds an MPH in epidemiology and environmental health. Thank you for joining us. Dr. Justine Witzke is the founder and CEO of A Lineage Fertility, a boutique sperm bank and fertility consultancy in New York City, providing high quality, equitably accessible andrology services, donor testing and screening, fertility guidance, and industry-specific consulting. Additionally, she is a co-founder and president of CP Extension, a nonprofit organization aimed at supporting families of individuals with cerebral palsy. Thank you for joining us as well. You can find full bios of all of today's panelists on the event website. So welcome to you both. And I guess to start off, we really just want to level set for the audience. Where did your interest start, ultimately made you choose a career in entrepreneurship?
We'll just hand it back and forth. Okay. Thanks for having me. So I'm an accidental entrepreneur, really. I did an undergraduate degree in zoology. I did MPH at what was this program, but the Hunter College MPH program. And I did a PhD in clinical and translational research at Mount Sinai while working at a large academic center in IVF. And I ended up growing in that field, learning, being exposed to the academic programs as well as industry, found a piece that wasn't really served, right? There's a group of patients or several groups of patients that I felt were not receiving the level of care and the level of detail to their care that everyone else was. So started to think about it, and I'll tell everyone this story. I actually was talking to a patient who was distressed over the experience at a different sperm bank. I was kind of joking with him like, oh, well, you don't have to go back. They're the only game in town. It's a real business opportunity. That's literally how it started. I walked back upstairs and I was like, maybe it is a real business opportunity. Started to put it together, and could I get enough investment from my friends and family to get it started? Could I get the licenses? Could I get the team together? And we're now seeing patients and doing what we need to do.
Yeah, and for me, I think I'm sort of a meta entrepreneur because my business invests in other entrepreneurs. The way I sort of approached it was public health has always been very near and dear to my heart. I've sort of viewed it as the way that we can hopefully prevent people from going to doctors' offices in the first place. And I observed in sort of the entrepreneurial ecosystem that while there was plenty of capital for therapeutics, med devices, healthcare delivery, there was very little capital available for public health entrepreneurship. And so it felt like a sort of obvious way to help accelerate and catalyze change within this field, was to then set up MBX Capital and ultimately partner with great entrepreneurs to help them build amazing businesses that can have really big public health impact.
Thank you for sharing. So you really already kind of level set for the audience what your companies are about. Can you kind of walk us through what is a typical day for you in the work you do? Just kind of broaden the scope for them.
Yeah, I'm happy to start. I can tell you about this morning. So at the moment, an area of public health that we're spending a lot of time in is the emerging field of exposomics. It's really focused on studying how our environmental exposures ultimately determine our health outcomes. There's good data now to suggest that over 70% of diseases that we suffer from today are environmental in their pathogenesis rather than genetic, but we have very limited tools to understand our environmental exposures. This is particularly important during critical windows of human development, such as the prenatal environment, which we were just talking about. And so this morning, I was spending a lot of my time thinking about conditions that newborns suffer from there are not great diagnostic tools available. Interrogating why that was. And one of the interesting findings from some of that work, which I've been doing over the past few weeks, is that congenital heart defects are actually not detected in 50 to 70% of cases using fetal echocardiogram or ultrasound, which are the typical techniques for doing so. And one of the reasons this is the case is, they're difficult to observe in imaging and so forth. But actually, most congenital heart defects, about 80%, are not a result of genetic factors, so they're non-syndromic. Um, the reason for this is they're very likely a consequence of environmental exposures. So one way that you can detect those exposures in the prenatal environment is by looking at cell-free DNA and looking at methylation of that DNA. And so I was spending a lot of time sort of reading the latest literature in the field. I then identified a few scientists at a health system that had run some recent work on this, reached out to them. Right now, it's a totally academic project, but our hope is that we can license and spin out and form a company around that to ultimately develop diagnostic for the most common set of birth defects people suffer from today. So that was kind of my morning, and a lot of days are kind of like that.
So for us, widely varying. Right now, my team is small. I have 2 full-time people. We have probably 4 or 5 other part-time or sessional people that we're working with. Lab director, medical director, psychologists, genetic counselors, nurse practitioners. So it is a interdisciplinary team. And this is, for right now, I'm the receptionist and I'm the patient counselor and I'm the business person and I'm the marketing department. So it's a little bit of a one-man band sort of thing. And a lot of companies start that way. Some companies don't, right? Some companies probably have enough capital that they build a whole big team initially. And just, a lot of ways, a lot of right answers to the same questions, I think. So for me, it really depends on what's going on. I'll give an example that last week had one day where we had 7 patients in the office. These visits are 30 to 90 minutes each. So I spent the entire day meeting with patients, filling paperwork, consent forms, like really, we were doing clinic hours. And then there are other days where I send, I don't know, 100 messages on LinkedIn trying to tell providers of trans women or of oncology patients or of fertility patients that you're another option for their patients. It also involves figuring out the money, figuring out who the payroll company is, like all kinds of back end business things that a lot of us, I certainly didn't have exposure to previously because I worked in a really large institution where all of that stuff sort of happens in the background. So for me, it's really, really widely varying. Will say that I expect that that will change over time, but one of the things that is really important as the leader of a new organization that is trying to kind of change how people think about our industry is staying connected to the patients, staying connected to that part of it, having conversations with the patients, never getting too far away from it that I don't know what they're really experiencing. I think that's always in the back of my mind, even though right now I have to do that. I want to continue to do that as well.
So it's great to hear these insights. And just touching upon what you mentioned, Gurdane, you said very research oriented, your role. So I guess my next question would be from the student perspective here. We're interested in understanding how your public health training prepared you for your entrepreneurial pursuits. And then what would you say are the skills you were able to hone in the field following your exposure? So what did you come in with? And once you were in the field, what were you able to fine tune better? How did it prepare you?
Yeah. So I think probably the most useful aspect of my public health training was the quantitative aspect of the training. A big part of my job is interpreting data and then also looking at data with a really critical eye. So thinking deeply about whether data I'm looking at is really causal or it's just correlation, what factors might influence that, understanding how trials may intentionally or not intentionally be manipulated to have a particular result, understanding the limitations of a particular type of research. So the work I did, particularly in epi and in biostats, was very helpful and continues to be very helpful in informing that. On the other hand, I also spent a lot of time within environmental health sciences focused on toxicology, which is, I feel, incredibly useful as you look at more qualitative data, but data that is more biological in nature rather than, we have 20 samples and we saw these results. So you might have, 1 or 2 animal models that you're looking at, or 1 to 2 pieces of data on a particular human subject, and you're trying to interpret what the potential toxicological effects of something might be. That was incredibly useful as well. I kind of post my MPH had that bunch of knowledge, I suppose. The way that it sort of expanded, I would say, is just by continuously investing in knowledge building within those domains. So the MPH I viewed as a starting point, not an end point. And as everyone in this room I'm sure knows, and we've all experienced, right? There's new ways to approach these problems sort of come out all the time, and staying on top of that has been really important.
I'm going to take the opposite side of this, that I would say, for me, my MPH, the focus was community health education. So the qualitative piece of it was actually the most important part from what I learned. And the PhD I did got me that stats background, got me that kind of ability to interrogate a study. And I think that's a critically important thing for all of us working in and around the healthcare field, especially as the environment changes, not the environment, but the healthcare environment changes. I think we do need to be really critical of the information that's being provided to us. However, when I think about fertility, when I think about this type of work that I'm doing now, there are data that show, and pretty robust data, that the number one reason why people drop out of fertility treatment before their family's complete because of the patient experience. So if I then take that piece of information and think about, how do we approach educating the patient? How do we approach making the patient feel like they're being seen, whether that's as a single parent in a multi-person family, in an LGBTQ family building experience, or a patient who's coming from a community where talking about fertility is taboo, or where they may have reservations about some of the ethical considerations, and thinking about how we can develop a program for them. I think that is something that really did come out of the MPH. I can't say I knew that at the time that I finished the MPH, but definitely when I look back at it now, really all tied together.
Yeah, I think speaking from my experience, I graduated, I want to say 3 years ago now, and doing an internship while studying was the best thing that happened, because those skills in the research position with Dr. Joshi really were able to provide me ways that my coworkers maybe necessarily didn't see data in a different way. So definitely, if you have the opportunity to do an internship while in school, that would be your best stance to get exposure with hands-on data. So then, Dr. Witzke, I guess my next question would be, what are the challenges and opportunities of introducing technology into the public health approach to address social and societal health determinants? So this one just really being oriented to yourself.
So it's interesting. I mean, I say all the time to new hires, people I talk to, people who are interested in the fertility world, that it is, that saying of like, if you're not moving forward, you're moving backwards. It's like glaringly apparent in our specialty, because technology is changing. What's available to a patient now is not the same as what was available even 2 years ago in some cases. And that's really rapid change. What that means, though, is that we, as the professionals in the space, have to guide and educate and really understand these things that are available. There are some limitations. We were actually talking about this before. There are some technologies that can be used in a laboratory. Now, I'll give a very specific example. I have a sperm bank, so we do semen analysis, and there are now machines that will do semen analysis. Really, really accurate. They're really easy to use. You don't even need the same level of professional staff to work them. But on the ends of the spectrum, they're not super accurate. So if the count is really low or the count is really high, you may not have the level of accuracy that you're expecting or that you're used to. And so I think it's a matter of kind of understanding those sorts of things, and that's where both the pros and the cons, or the challenges and the benefits, come from introducing technology, that maybe you can be a bit more efficient, maybe you lose a little bit of accuracy. And I think part of the entrepreneurial experience is making those judgment calls and being able to integrate everything you've learned academically and professionally and just as a human over the last 15, 20 years to apply that to what we're doing. And then I think, I could go on about this part of it forever, but the use of technology in helping to educate patients, I think, is believably important. It provides access, and first level of proving access is that people even know something exists, and that they know it might be for them, or that it might not be for them. And I think that's obviously an easy use of technology in some ways. There are limitations to that as well. That we probably don't have enough hours for that.
So then, Gurdane, for yourself, what do you think, in your opinion, makes an investment worthwhile to you?
So there's a few things. First and foremost, we only invest in things that we believe will have significant population level health impacts. And in particular, we will look for solutions that are going to be durable. The one thing we really care about is sustainability of an enterprise. So there's a lot of I think, types of public health entrepreneurship that are certainly important, but are really focused on perhaps like Band-Aid solutions, right? We have a big problem and we're trying to solve this for the next 5 years. What we try to focus on at MBX is the solutions that will hopefully be durable over the next 30, 40, 50 years, right? That can make that really long-term, mega scale type of impact. So that's sort of first and foremost. The second sort of layer of this is we recognize that not all domains of public health are appropriate for private capital. And private capital can sometimes fuse incentives into an enterprise or a project, may be contradictory to the intended goals, right? We see this all the time within healthcare specifically. So we try to be really mindful about what those incentives might be and ensure that we're not investing in areas where we could create perverse incentives and actually have the opposite effect that we intend to. The third piece for us is identifying the right set of people to go out and execute on the vision that they have. So a lot of people will have a really great vision, right? They have a very clear picture of what the world should look like. But the challenge is they need to have incredible founder market fit in order to pull that off. So we look for people like yourself, right? Where like you did your PhD focused on this specific problem. You started a company focused on that problem. Like you have 0.001% domain knowledge in the area you're building. We love that, and we look for that across all the enterprises that we seek to invest in. In some cases, you might have a founder an amazing founder that doesn't have that experience, but they've found the right partner, a co-founder that can bring that knowledge to the table. So that's one way to solve for that. And the last piece that I'll sort of mention is that, whereas at the end of the day, we are a private enterprise, right? We have our own investors that we have an obligation to return capital for, and we have to be good fiduciaries for. We have to be able to actually produce a venture scale return. That ensures the sustainability of our enterprise and allows us to keep doing what we're doing. So those are probably, there's many more pieces to it, but there are 4 that I'd call out that are particularly relevant. Oh, sorry. What do you look for in an investor?
Well, yeah, I think so. It's interesting. Like the fertility space, and I know I'm super specific on this fertility thing, so hopefully somebody's interested in it. But fertility space has gotten a lot of private investment in the last 5-8 years. A lot of venture capital firms, private equity firms, kind of traditional large financing organizations have invested in fertility. There's been a lot of merging and combining of practices, and with the aim at efficiency. I think it's yet to be seen what that impact is on our specialty. In the midst of that, I put together a private practice with only friends and family fundraising. And we're trying to make it a sustainable business off of patients we see, the work we do, the consulting work that we're able to do, with not as much runway and really not as much of kind of a traditional fundraising method as a lot of other companies would have. But I will say, even in that, I had people where the first meeting were really not into it. And I didn't want money. I didn't want them to be involved in it. It's something that for me, as I care so deeply about it. I hope that comes across to everybody. I want a team of people who are supporting me, supporting the work, supporting our patients, who are really, really invested in how we're going to go about doing it. And what I have found, if I look at the list of people who invested, they are the best interdisciplinary group of people, of advisors, of people that I couldn't have put together a group like that. And if I had said, okay, I need this many lawyers and this many marketing people and this many physicians, never would have put together the kind of group that I actually organically put together. So that's the other side of it.
Yeah, maybe just to close out this thread, I think so much of fundraising is about just finding your people. Sometimes I observe, I've done this myself, we'll get caught up on, oh, this person didn't want to invest, or this group didn't want to invest, or really like capital from X or Y organization. And it turns out that it's actually, frankly, a bit of a numbers game. And the point of the numbers is just to find the people that are most aligned with your vision, your mission, and what you want to do. So not getting too caught up in like the exact names or folks, right? There might be folks with, that are really public and have ostensibly great reputations that actually would be terribly unaligned partners. And it sounds like you found some really aligned folks.
Literally, origin of line and me.
Amazing.
So for newcomers that are interested in pursuing a career in entrepreneurship or dipping their toes in that field, what would you think are some best practices or skills that you recommend be honed?
I probably need to know the answer to this question. So I would say a couple of things. I think in public health, in healthcare, in this sort of entrepreneurship, one of the things that maybe not to pay too much attention to is like your own age. I think there's this like kind of thing out in the world, in the media, that entrepreneurs are 22 years old. Not all 22 years old. And to your point of finding people who have become subject matter experts, it takes time to become a subject matter expert, to have network, to have enough people who you can call and say, hey, I have this project. You want to hear about it? You want to tell me what you think of it? I didn't have those people when I was 22. And so I think that's a really important thing to just remind yourself of if entrepreneurship is interesting to you. The other thing that I wish I had done previously is now I am completely willing to call or email or contact anyone I have ever met or maybe have never met, and not sure that I would have done that when I was 22 years old, and I kind of wish I had. And I wish I had been growing the network more intentionally earlier in my career. It doesn't mean that there aren't people who knew, early on that aren't involved, but I wasn't strategic about it in any way. I think, it's become one of the best parts of this whole experience is the outreach and talking to people, and people have been unbelievably generous of spirit, of time, of introductions. And often that's what, often there is no ask, right? I often ask people like, love to tell you about this project and get your impression. That's it. That's all I ask them for. Then sometimes that results in something else. Sometimes it doesn't. And almost always people are willing to give you their opinion. So
People like giving their opinion. That's why we're here.
that's what I like to give my opinion too.
So maybe just to add to this, I don't think that there's there's like a pure phenotype of what makes a great entrepreneur. There's lots of different ways to be a great entrepreneur and lots of different people that can be great entrepreneurs. That being said, one characteristic that I've observed in a lot of people is sort of radical self-belief that they'll figure out any problem or challenge that arises. They really feel like it is the highest and best use of their time. If there is nothing else they could be working on, it would be a better use of their time. And when those two things are met, I think that's a recipe for grit. That's, I think, really important because this is crazy difficult. like the journey is often like 3 or 4 times longer than people anticipate. And you need people that are prepared to go through that. And I think that sets the table well if you have those two characteristics, able to make it through that.
Seems like that's sort of it.
Yeah. I think you need to be a little delusional. I fully believe that to start a business, or any kind of enterprise, whether it's a nonprofit or for profit. Yeah, the odds are so likely that you will fail. You need to, for some reason, feel like you won't in order to get going. It's just a form of delusion. Yeah.
You have to regularly going. Yeah, like you have to regularly be tell yourself.
Yeah, like you're thinking you have to have this belief that you're somewhat exceptional in a certain way. I think the important thing though is regulating that. Like if you let your delusion run wild, like everything's written in moderation, right? Like a moderate amount of delusion, probably good. Too much delusion, weird stuff starts to happen. There's plenty of people in the press. I'm sure you can think about that.
I have one, other comment on that, which is you probably hear like there's a saying of like the entrepreneurial roller coaster and the highs and the lows, and that I would say that's real. I don't know if you have that same experience. What I think no one could possibly prepare you for, even if I say it right now, you still won't be prepared for, is the rate of change between the high and the low. It really can be 5 minutes later and you're like, this is the greatest idea I ever had. This is going to be wonderful. And 5 minutes later, you can be like, I might have ruined my life and all of my friends and family's lives. Not quite that extreme, but it really does require a willingness to like put yourself through that experience. Right. It's not something like going in and I'm clocking in. Like we were talking about, like get out of the city. Not necessarily, right? It kind of depends. It's whatever you have to do, make it happen.
So we're wrapping up soon. So my last question would be, concern that students may have when they start applying for jobs is that entry-level positions are anywhere between 2 to 3 years. Not sure if everyone started applying. It is difficult putting yourself back in that space. You come out with the MPH, MS, and you have maybe 1 year of research experience. So what would you, what roles should folks consider taking to prepare themselves for entrepreneurship? And I think really just a career in public health. There's some good first starter positions to apply for. I think that's the most important thing, like what roles are out there, like keywords.
I wouldn't mind. So, couple ones that you might not be able to get right out of your MPH. It might be possible maybe a year after. One role that I think is great and prepares people really well for entrepreneurship is chief of staff roles, particularly at early stage companies. The reason for this is that you're often sort of person that is the shadow to the CEO, and is interfacing with everyone else on the executive team. It's a hard job. Like you work the CEO's hours, some more. But if you're prepared to do that and put that effort in, get exposure that you just can't get any other role in an organization as a relatively junior person. That's one that immediately comes to mind. And those roles exist, at nonprofits, at businesses, at startups. They're all over the place. That's sort of one key role. The second thing is, I think, be a little less specific here, but finding a specialized area, I think, is highly valuable. So we've been talking about this, the importance of domain expertise. And in order to build that domain expertise, you need to focus. So you may not know exactly what you want to focus on, but pick the most likely thing and start pointing in that direction. And that may change over the years, but at least have gotten started. So that might be saying, if you're an environmental health person, I want to, change the world in, how we do environmental sensing and monitoring, going and finding like that really specific sensing business, learning everything you can about that field, and then communicating that you've spent and invested time in understanding what it is they do, will stand out in the crowd because most people wouldn't have put that effort in. So I think that's sort of at least one way you might approach looking for early roles.
I'm sure I said this earlier, a lot of right answers to the same question, I think, with all of this. So my personal life experience is that I got into fertility by accident as like an entry-level position. I worked the front desk. I was a patient educator in fertility. Then through building relationships within my workplace, in really trying to learn the specialty, trying to learn what we were doing, and really caring. I know that sounds like a little cliche, but like really caring about what we were doing. I had the opportunity to formalize the fertility preservation program at the department where I worked. And that meant doing the outreach and designing the program and designing the patient education. And it was like, when I look back at it now, like a little mini boot camp of entrepreneurship within a really safe space, because I got to build sub-department within a department. There was a lot of resources, but was kind of free to do it. And then I ended up being head of clinical operations in that same organization. And that department, again, it's kind of, there's a lot of safety in a large institution like that. But we had about 300 staff, and that's sort of that chief of staff type of role where you're exposed to the regulatory pieces of it, the financial pieces of it, the patient education, the program, like what are you offering to people? And it allows that kind of exposure, but also that kind of thinking that is required to say, "Yeah, I'll figure out how to get a issue banking license. I'll figure out how to do all of those things." And so I think I came at it probably from more of a generalist approach within a specialty. That worked for me, but there are a lot of different mechanisms, I would say, for it. And caring about what you're doing, I think, is probably one of the best litmus tests of like going and doing the work. And I often, when I interview people, will ask them about their prior job, what they liked the most and what they liked the least. And it sounds like a softball question, but really it's like the thing they say they like the least is the type of job they're applying for. Probably not the right job for them to apply for. And one of our jobs as being the leader is having people doing the thing they're best at, so that we're getting the best work, we're getting the best outcome as a business, as a provider, those things.
Thank you both for sharing. I think we're moving on to the Q&A, right? Okay, so anyone in the audience has any questions or via Zoom as well, let us know. Yeah, go ahead.
Maybe not as much money in women's health. You see that as an opportunity to invest in women's health because it hasn't been like used yet, or I don't want to say exploited, but like utilized to the business opportunity, or is it like worrisome because there's something like difficult about that space that it's hard to get a return on investment? That makes sense.
Yeah, so from an investor perspective, first of all, women's health is like literally half of all, right? So it's, a massive, massive category of things that includes so many different types of care. And I think interfaces with every single specialty, not just, we'll think about it conventionally as like OB-GYN, like so much more than that. So I think any serious person thinking about how to allocate capital in this field has to think deeply about women's health. I think that's starting. So a lot of the largest investment firms in healthcare are now thinking deeply about that. Fortunately, my one criticism would be that a lot of it's surface level. It's like, we'll put a shiny box and like nice user interface on something, but you're not really getting to the root cause of a particular problem. There are increasingly more and more entrepreneurs that are focused on some of these really hairy, difficult, sort of like root cause challenges. One example of this is there's a company here in New York called May Health, started by an amazing woman named Maya Hartigan. Full disclosure, we're an investor, but she's focused on specifically the maternal health journey for Black mothers in America, which unfortunately that community has some of the worst maternal health outcomes in the developed world. It's sort of an embarrassment to our country that we've let it get so bad. There's a huge opportunity to fix that. She understands that experience firsthand as a Black mother herself. She has deep domain expertise. She spent a career working in digital innovation at Pfizer. She's partnered up with people understand that problem set. Now, Medicaid plans increasingly view this as really important as well because they see the outcomes in the members that they manage, and half of kids born in America are born on Medicaid. And so they want to solve this problem at the top of their list of things to deal with. They don't know how. And so what May is doing is creating really robust infrastructure by providing supportive care through doulas and education and so forth throughout the pregnancy journey and in the postpartum journey in order to improve health outcomes in that community. And I think will make a huge impact. So I think that's an area where there's a ton of mission alignment. You do need capital to get something like that off the ground. But it is a big opportunity, in women's health. And there's hundreds of other examples, I would say.
Yeah, I mean, I think fertility in the grand scheme of things is a small, small bucket within this concept of women's health. I also think this, forgive me for this, fertility is not only a women's health issue, right? And I think in a lot of like the recent news and the Alabama ruling on IVF, and it was media framed it as this is a women's health issue that IVF is potentially being limited. And actually kind of was like, well, yes, but it's also a family health issue. And there are, firm factors contribute to 50% of fertility challenges. And there are families that have single male parents, they have two male parents, they have ever family arrangement there is. Fertility is not uniquely a women's health issue. Yes, you need an egg. Yes, you need a surrogate or someone to carry the pregnancy, but there are so many different factors to it. Fertility is unique in the sense that there's a lot of money that moves around in the fertility world. It can be expensive. Insurance coverage isn't wonderful. Medicaid doesn't pay for anything. They don't even pay for fertility preservation, sadly. So there are, kind of a lot of considerations with all of that, but there are traditional investment firms that are interested in fertility and that aren't necessarily interested in some of these other women's health, considerations that are critically important.
Yeah, maybe just like one final note on this is another example of how this is relevant outside of fertility, right? Is if you think about clinical trials enrollment in this country, the vast majority of people enrolled in clinical trials are men. And unfortunately, what that means is that extrapolation of data from those trials to women is just not super well informed. And so there are enterprises now focused on how do we increase diversity in clinical trials, not only by thinking about sex, but also by thinking about the types of communities that are enrolled in those studies and enabling access. So that goes way beyond just fertility, right? That's across every single disease indication you could imagine. A lot going on there as well. Great question.
Hi, I'm very interested in the intersection of technology and public health, especially for low-income communities. I come from a tech background, and in my past life, I obviously only thought about tech products for people who can pay. And hence, a lot of times, the technology doesn't reach the low-income communities because we perceive that they cannot pay. So I see a lot of tech innovations happening only from Medicaid because somebody else is paying for them. Can you think of anything else when you think of technology reaching the underserved? As an investor, there might be some opportunities that you're thinking about, but when I think about revenue models and business models, not a lot of them come to mind, except Medicaid innovations.
Frankly, I think that Medicaid is the source of capital for low-income communities by and large. It is not the only source, though. We have a portfolio company called Atlas Health that focuses on matching patients that are uninsured or underinsured to access what would otherwise be very high-cost drugs, often specialty infusion drugs, oncology drugs, and so forth. That might be $20,000, $30,000, $100,000 a dose. When a patient is really sick, right, the hospital is going to administer those medicines. Typically, what will happen is the hospital will buy that medicine up front. They administer the dose. The patient gets a bill for $100,000 that they can't possibly pay. And the worst case is the hospital starts to sue some of these patients, which is totally crazy and inane. Happens. So the issue is the hospital is actually out $100,000, right? They spent the money on the drug. There are other aid sources that could help cover that. So there's pharmaceutical companies, philanthropic assistance foundations, patient advocacy groups, as well as specific government programs that are distinct from Medicaid that operate at the state level, offer funding for those types of drugs. So what Atlas does is they algorithmically match patients to those programs and help them get enrolled, which is a very complex process. As a result, they've been able to not only help hospitals avoid bad debt, but most importantly, enable patients to access medicines without the trauma of medical debt that they would otherwise experience. And so that's another mechanism. Again, there's besides Medicaid and that, I have a hard time thinking of other sources. Any that you can think of?
What if, let's say there's something that's like a monthly subscription to a patient education, and they're going to say, okay, I'll pay $99 a month to get access to it. And what if the company was like, actually, you can pay $9.99 and we'll give out 2 subscriptions to underserved. And like, you're kind of utilizing your patient base to do good in the world. Really like to do good in the world, and it may be able to be done. I literally made it.
That's actually a form, though.
But like, it's like the Bombas concept of like to buy something.
I think a variant of this that actually does occur, right, is have very large companies, right, that are self-insured employers that might have, and actually even medium-sized folks, right? Let's take a 50-employee restaurant. Those owners typically don't provide great healthcare, but they want to. So we met a company last week that's focused on increasing the type of health benefits that could otherwise be offered in the restaurant industry, which employs a huge number of people that are, have a hard time accessing insurance through conventional means. And so there are ways to access capital pools that maybe exist in businesses that are distinct from insurance as well. I wouldn't say it's easy. That's a third way.
Any other questions? One in the back.
Also, if so, what skills would you be looking for a candidate or job experience at your company?
Thank you. So as a super, super small team, we hire like minimally as minimally as possible. We are working with one lovely student in this program who's working with us this semester. So we have those kinds of things where we're doing, I take on a student each semester, and they help us, and we, hopefully we're helping them as well. Right now, I mean, literally the only job I'm hiring for is a per diem nurse practitioner, which is like a very, very specific thing. But I would say, as a super small company, one of the things that I'm really looking for is fit and the interest in what we're doing, right? And there are lots of nurse practitioners who've applied for this job, but then when they hear about it, it doesn't quite fit with what exactly they're looking for. And I can tell that it's not, they don't feel committed to it in the way that we're looking for that to be, and the way that this founding team is committed to it. So really looking for a lot of like a fit thing rather than some specific resume. I mean, my resume is not any specific resume that would have gotten me hired anywhere, other than caring about the work we're doing and it being the right person at the right time for the organization.
So we're not hiring right now, but we have 40 portfolio companies that are. So if you go to our website, mbxcapital.com, you'll see a bunch of businesses that are hiring that are within this field. If I was hiring, the things that I'd be looking for, number one would be technical expertise, the ability to really deeply interrogate data and be a deep thinker. Second would be obsession. So one thing that I think makes a good investor is that you have to be able to get up to speed on areas pretty quickly. And you have to sort of just get obsessed with a particular thing. Like right now I'm looking at, since a totally different field, a chitosan business, which is like a crab shell extract that's actually really good at removing heavy metals from water. So I've been thinking obsessively about that, right, for the last couple of months. So having that trait, the willingness to do that, and just like loving learning, I think is really important. And then the last piece for us is just willing to do whatever it takes to get whatever you're focused on done. Might mean jumping on a plane the next day to fly halfway around the world to go meet a company or entrepreneur. It might mean supporting an entrepreneur through a really hectic process or a hiring or firing decision at 9 p.m. when they call you randomly or text you. Sort of stuff is really important in this job. So it is an always on type of job, but if that sounds appealing to you, keep in touch.
So last question to wrap up. And I think a lot of us would wonder this as well, like knowing what we know now, what questions would you have asked earlier on in your career to avoid hardships, late nights, struggling? What would you have asked earlier on to really make the experience a little more manageable?
I'll be really quick. I actually just would have asked for advice more often. I didn't ask for advice as much as I should have. When I encountered a difficult problem, I would try to solve it myself. And I think it's valuable to a certain point. Like if it takes an hour to figure it out, it takes a few days or years to figure it out, you should probably ask for advice. And I just didn't do that when I was young as much as I should have. And that was particularly foolish because when you're young, you have the superpower that people will respond to you because you're young and they want to sort of pay it forward. By the time you're my age, you start to lose that. So I definitely should have done that more often.
I definitely second that. Yeah, all of the parts of it, because people, like I was saying earlier, people like to give their opinions. They like to help other people. I would say I also don't mind some of the late nights are no issue. The early mornings are no issue. The little bit of heartbreak is part of it for me. And I think being willing to do this, being willing to do anything at a super high level is going to involve some of that stuff. And I think I feel really at ease with that. And I know that that's not a completely agreed upon thing, but with what I'm doing, like kind of to your point, I met a patient at a hospital where they were having another appointment to drop off paperwork and collection cups yesterday after work, because that's what the patient needed and that's what entrepreneurial experience is like. And maybe it's not as glamorous of sounding as I went around the world for a meeting, but it's the same concept, right? That you're going to do whatever you have to do to make it happen. So ask for advice, be nice to people. I think I was always doing that one, but who knows?
I think just to wrap up, I think from my experience, I would just say the opportunity to know that you are in such an important community and taking advantage of the network that you have here, the professors as well. And if you have the opportunity to find a mentor, that really makes a difference early on. So that would be my recommendation on that. And I want to just, thank you, Gurdane, and, Dr. Witzke, on your insight on entrepreneurship and really, staying here with the students to help them navigate these new kind of career paths that are available there. And then, yeah, now I'll just pass it on to Wilson for next steps in the event programming.
Thank you very much. Okay. Well, thank you everyone for joining, and thank you to our panelists for giving your time to be able to talk about this and offering us advice. Let's see, in terms of next steps, if you're interested in connecting with our panelists, their contact information will be made available on the event website. And we will be heading back to the auditorium for the afternoon keynote panel, followed by closing remarks by Dean Ayman El-Mohandes. For those online, you can head back to the main Zoom room to watch the keynote panel. And then kindly ask on your way out, if you haven't already signed in to the sheet that's behind you on the white table, please do so. Or else, not actually, but it means a lot. Goodbye. Thank you.